Yes. Now we'll be moving towards the axillary brachial plexus block. First of all, I'll show you the patient position. The position is to keep the hand below the head in this position. But if there is trauma of hand, fractures, or abscess, or there is an injury of the hand for which you are going to perform the surgery, it's fine. You can keep it like this. Okay. So this is the axillary crease, and we are going to keep the probe onto the axillary crease to identify axillary artery. And that is a point where from we are going to identify all the structures around the artery. And then we are going to move laterally to find musculocutaneous nerve. Musculocutaneous nerve will be found between the coracobrachialis and biceps brachii muscle. Right? So now, first of all, we are going to keep it here. So there, now we can see on the screen a round pulsating structure that is an artery. And clearly we see, now if we see, there is a round structure, hyperechoic white structure above the artery. This is the median nerve. Now if we see below the artery, there is again a white structure, little higher. Yes, this is the radial nerve. How's it? Right. So this is the radial. Radial nerve lies posteriorly to the axillary artery. So, but on ultrasound, posterior image appears inferiorly. So this is the location of the radial artery. It can be at 6 o'clock or it can be at 5 o'clock. Median nerve is located superior to the axillary artery, above the axillary artery, and it can be at 12 o'clock or it can be at 1 o'clock. The radial nerve is located at 6 or 5 o'clock. Then is the ulnar nerve. Ulnar nerve is located on the medial side of the axillary artery at this area. We can see a white, probably I think this is, I'll do again sonoanatomy, but this white structure seems to be the axillary, the ulnar nerve. And you can see a triangular fascia. This fascia has all the three nerves, the axillary artery and axillary vein somewhere that we have compressed. Now the screen has been frozen, so we are not going to see it. And then if you see laterally, this is the medial part, this is the lateral part. If we see laterally, there is a muscle bulb in which there are 10 white hyperechoic lines. And here we are going to look for the musculocutaneous nerve, which is going to be somewhat like this hyperechoic white structure. First of all, the axillary artery. We have identified axillary artery. We have identified a grape-like structure above the axillary artery, which is the median nerve, and then a hyperechoic structure below the axillary artery, which is the radial nerve, and medially towards the axillary artery, we are going to find ulnar nerve. So these three nerves surrounds the axillary artery in this axillary sheath. Now, if we move a little laterally, because with this much anesthesia and analgesia, we are going to cover up the elbow, forearm, and below, but lateral part of the forearm will be spared. So for that, we are going to block the musculocutaneous nerve. Now, if you see, I'm moving the probe laterally. I'm moving again at that position. Now I'll be moving the probe laterally. This white structure, I'm going to freeze the screen. This white structure is the musculocutaneous nerve. I'm going to adjust the brightness.
Snake eye appearance.
Yes. This is the musculocutaneous nerve we can see. So we block it. Again, you can come from the medial side or the lateral side, doesn't matter. You can come in plane, you can come out of plane, doesn't matter. But you should see your injected surrounding the nerve, making an island that we call it. Likewise, we are going to block the musculocutaneous nerve.